When we're off the air, we'll have these back on, as does everyone in the room around us. You mentioned that the surge is having a major impact on hospital capacity across the region, and it's not just COVID patients being impacted. One of the first areas impacted in the ER. What can the community do to help with this?
Yeah, so the first thing we would want to say is really assess what's going on. Certainly, if you have a condition that is not deemed or you don't believe to be an emergency, please don't go to the emergency department for non-emergent care. Clearly, if you do have an emergency, then that's where it's for. But we really want to make sure that we reserve the ED, the emergency department is really for those that really have true emergencies, because again, it is just extremely tight, and we want to make sure that those people who are there for emergent care get the best care that they can.
Federal officials, health officials, announced this week that booster doses of the COVID-19 vaccine will be made available sometime late next month. What's the difference between a booster and a third dose?
Yeah, there's a lot of discussion about that, and I just want to let you know that yes, the plan to release booster doses has not yet taken effect. That's planning to be next month. Right now, what we have authorized by the Food and Drug Administration as well as the CDC is a third dose. So here's the difference between the two. A third dose, even though a booster and a third dose are sometimes used interchangeably, and it refers to the same dose of your mRNA vaccines, the intent of a third dose is to provide that extra protection in populations that are not able to generate that immune response. So patients that are immunocompromised, patients with cancer, transplant patients, patients on large doses of steroids, when they got the first 2 doses of the vaccine, they were not able, or many of them were not able to mount that antibody response to really get that protection. So as a result, a third dose is what is recommended to help hopefully get their immune system up to where that is. Now that's different from a booster, which is intended for patients with regular, normally functioning immune systems, that they, after 2 doses, they do have that protection. But we do know, and the data has been coming out on that over time, over a period of several months, 8-9 months or so, that immunity starts to wane, and then that extra booster, again, the same vaccine, is necessary to get that, to just get that, boost that immunity up to more normal levels where you can be protected against infections and severe disease.
Okay, lot to unpack there. We do have our first question from the media. This comes from Ezzy Castro with News 6, who asked, what does the booster news mean for children? Will they be getting boosters?
Well, right now for children that are under 12, there aren't even regular vaccines available yet. So we have to wait for that authorization to occur, hopefully sometime in the fall. But for children that are over 12, the same rules apply. If a child who is under 18, for example, has a very weakened immune system because they're on cancer or they require certain types of medications to suppress their immune system, they would be eligible for a third dose just like everyone else. And presumably next month, when the FDA authorizes booster vaccines, that should apply as well to children that are over 12.
So people who are immunosuppressed can receive a third dose of the vaccine. How will the process work for AdventHealth patients who are immunosuppressed, like, for instance, transplant patients?
Yeah, so right now the guidance is that these patients have already received 2 doses. They should go and get their third dose if they meet some of these criteria. This includes, again, transplant patients, cancer patients, patients with HIV that's not well controlled, patients with underlying or hereditary immunodeficiencies. Some of them are not very common. But in those cases, they can, what we would suggest is that these patients talk to your doctor, talk to the healthcare team about the timing. Because sometimes when you're getting chemotherapy or you're getting medications, you can time them so that your immune system is more active and get your dose at a certain time, as opposed to another time when you're medications cause your immune system to be a little bit more depressed. So number one, please talk to your doctor, make sure the healthcare team is aware, work with them, and then you can certainly get that third dose at any number of places. The pharmacies are now offering that, and other places.
So one of the things we've heard a lot about lately are what are called breakthrough cases. I want to talk about that for a sec. First, I want you to tell us very briefly what a breakthrough case is, and then why is it still important to get vaccinated if we know there can be some of these breakthrough cases?
So breakthrough cases are COVID infections that occur in a patient that has been fully immunized. And when we're talking about fully immunized, if you got your mRNA vaccine, it would be 2 weeks after you received the second dose. Now, unfortunately, there may be two reasons for breakthrough infections that we're seeing more commonly. Number one is the Delta variant. The Delta variant is a mutation in which the effects, the efficacy of the vaccine just isn't quite what it was with your wild type or even the Alpha variant for that matter. But the one thing that's really important is to recognize that there is still significant protection, especially against severe disease and hospitalizations and death in persons who are fully vaccinated. That's really the most important thing. We are seeing breakthrough infections that occurred in some healthy individuals. These are very mild. We have seen breakthrough infections that have resulted in hospitalizations, but these are in patients who have severe immunodeficiencies. They don't have the normal immune system. They have severe chronic conditions that put them at greater risk of not mounting that immune response. So it is terribly important, incredibly important to continue to, if you haven't been vaccinated, to get vaccinated, because it is still the best bet to protect you against severe disease, hospitalizations, and death.
We mentioned at the start of this live stream the high number of people in our hospitals with COVID-19 right now. Can you tell us a little bit about the demographics of the COVID patients we're treating and how that maybe has changed since the start of the pandemic?
Well, we are seeing a trend toward younger people being infected and being hospitalized. The median age has now dropped from the 60s to the 50s, and it may be in the 40s right now. So half of the patients are over 40, half of them are under 40 approximately. And we're also seeing a lot of these relatively healthy individuals, those without, young, healthy, without a lot of comorbidities or chronic illnesses, are getting quite sick. Some of them have to be on ventilators, and some have died. So it's really no longer a disease where if you're elderly and you've got a lot of chronic conditions that puts you in the hospital. We are seeing more in the way of younger people, and again, probably a lot can be attributed to the fact that the Delta variant is now just so widespread.
A reminder, you can send your questions to us. The phone number to text them is 407-490-3075. Again, 407-490-3075. You can also put your questions in the comments section here on Facebook. And we have a question from Facebook for you, Dr. Hsu. Is the booster the same shot as the shot that was given with the first two shots?
Yes, it is. The booster, the third doses, they're all the same dose. Now, right now, the booster or the third doses are only authorized as an mRNA vaccine. So if you got Moderna or you got Pfizer, the two doses for that for your primary series, you should get the booster dose with the same manufacturer that was given originally. Now, if it's not available, if you had Pfizer and there's only Moderna available, then you can go ahead and get Moderna. But it's really only right now for the mRNA vaccines as far as the booster is concerned. They don't have enough data right now for Johnson & Johnson recipients, but I'm pretty certain that that we're going to need to give boosters or third doses for those that got the Johnson & Johnson vaccine as well.
We have another question for you from the media. This is again Ezzy from News 6. Is there a high demand for third doses for AdventHealth?
So we have to remember that, again, the third doses are for patients that have severely weakened immune systems. So the number of transplant patients or cancer patients are relatively small relative to the overall community, probably between 2-3% or something like that. So the demand is not nearly going to be what it will be when we start, when the booster doses become authorized by the FDA, which we anticipate sometime next month. But AdventHealth is working on a process to make sure that we are able to give third doses and booster doses when that becomes available.
Let's transition, if we could, to talk about children. As an epidemiologist, an infection prevention specialist, what are you looking out for now that school is back in session across Central Florida?
Well, there's a lot of parameters that we continue to look at. I serve on the medical advisory committee for the Orange County Public Schools, so I keep in close contact with Superintendent Jenkins and Chairperson Jacobs on that. We look at a variety of metrics. I mean, we are certainly looking at the number of cases of COVID that occur in schools. We are looking at the number of cases and the percent positive rates in children, and of course, we look at our hospitalization rates in our community. So, for example, in Children's Hospital, we typically have right now a number of hospitalized children. It's generally in the mid-teens, 14, 15, 16, and this is a higher number than we've ever had compared to any time previous during this pandemic. So we're keeping an eye out on that. We're not certain if the Delta variant results in absolutely more serious illnesses, but given that it's just so infectious, we are seeing more infections among children. So we have to keep an eye on that and watch for outbreaks within our schools.
So we've learned that children generally don't become as sick as adults with COVID in general. But the bigger concern, I guess, is that children can serve as asymptomatic carriers. So why is that so concerning?
Well, the concern is if you don't have symptoms and can pass that on, which we know does happen, that is a nidus for spread to the community. Again, that is why it's so important that children wear masks, especially in school. We want to encourage that as much as possible. Just because there are, yes, of course the patients or the children that are symptomatic, we want them to stay at home, but there may be a number of children who don't have symptoms. Wearing that mask does help guard, does help reduce the risk of transmission to others.
I have another question from the media for you. This is from Mike Gramajo of Telemundo Orlando, who asks, for patients receiving monoclonal antibody treatment and never got vaccinated, should they still consider getting vaccinated, or is there a time period patients should wait to get vaccinated after receiving monoclonal antibody treatment?
So there's several parts to that question. The first thing that I want to say, and this is again very much based on the data and what CDC says, is that if you have COVID or had COVID, you should get vaccinated sometime later in the future. It could be as early as 2 weeks. If after your acute illness gets better, after you're non-infectious, you could get your vaccine as early as that. Now, if you did get monoclonal antibodies, there are the potential for what we call competition with monoclonal antibodies and the vaccines working against each other. So the recommendation is that if you get monoclonal antibodies to prevent to reduce your risk of hospitalization or severe illness, which is what we always would recommend, you need to wait for 90 days until after that monoclonal antibody is infused before you get vaccine, just to make sure that all the monoclonal antibodies effects have waned off, and then you're clear to get vaccinated.
Let's go back to talking about children again, if we could. Most children who get COVID will not end up hospitalized, as a general rule. What are we seeing right now in our AdventHealth hospitals?
Well, right now we are still, most children are not seriously ill. That's true. But again, we are seeing a greater number of pediatric hospitalizations now, partly owing to the fact that Delta has just been so widespread. We're not certain whether it really causes more severe illness. Most of them are going to recover fine, but unfortunately, we're seeing this nationwide. The number of pediatric hospitalizations have increased, and for some of those children, unfortunately, it could result in significant, serious hospitalizations and ICU care.
You mentioned a little earlier that the vaccine is not available for children under 12 right now. Do we have any idea when it might become available for children under 12?
The trials are undergoing right now for pediatric patients under 12. The FDA in June did ask the manufacturers of these vaccines to expand the enrollment a little bit more to make sure that they identify rare but serious side effects such as inflammation of the heart muscles. So I am not certain if that's going to delay the results of these trials. We expect that the results will come sometime in the fall, maybe October, November, and then they still have to apply for FDA authorization, emergency authorization soon after that. So, we're still looking probably toward the late fall at the earliest for authorization of these vaccines, and I would love to see that occur. I have a 10-year-old child who is not yet able to be vaccinated. He's in school, and so I'm really looking forward to seeing those results as soon as possible.
So it looks like the next 3 months, with next month with the booster and third doses, and perhaps that coming, are going to be pretty active with the vaccine and the FDA.
Yeah, it's going to be a crucial few months ahead, but the good news is that we are slowly expanding. We're learning more about this. What we want to do is to provide the best protection for our community as widespread as possible. And the more time we have dealing with this pandemic, the more we know, the safer, the more we can protect our community.
I have another question from the media. This is from Paul Rivera from West 2 News, who asks, what is the mental health status of the medical personnel dealing with the surge in COVID patients? How are they feeling?
It's so hard to describe in words. It's almost you can see it in their eyes. It's just this palpable feeling of fatigue every day. The pressures that they feel, the crisis staffing that's going on does take its toll mentally. AdventHealth is very aware of this, and we have mobilized our mental health resources, employee assistance programs, to really make sure that we do everything we can to address this issue. I mean, there are some things that are beyond our control, obviously, but what we can do is to focus on the mental health of our providers, because fatigue and stress will affect the care that you give, and we want to make sure that we can do the best we can reverse that.
A question from Facebook for you. Would you recommend flu shots this season, and how much time in between the flu shot and a booster or third dose?
We are expecting that this will be a significant flu season. Last season, there was virtually no flu anywhere in the world, for that matter. But as people have opened up, as the masks have been coming off, as distancing has become a little more close to normal, we are going to see a resurgence of flu. And there's going to be some problems that we're going to expect for this year, because there has been a lack of immunity from last year to flu. We're not sure how well the flu vaccines are going to protect us against the actual strains that occur. And also there's the potential for COVID and flu to infect the same person. That really could signify a significant winter surge. So we really want to make sure that, yes, you get your flu shot, because it is the single best way that you can take, the single best thing you can take to prevent getting the flu, just like COVID vaccines are to prevent against COVID. And certainly that is one thing we certainly recommend. Now, the good news is that you can get COVID boosters when that becomes available, and flu vaccines at the same time. You can get one in either arm, so that's one thing that is good. Just kind of get it done with.
Well, I think another good piece of news with that is that all the things we've been doing to protect ourselves from COVID-19 will also help us protect ourselves from the flu, or really any other kind of virus that's going around, right?
Absolutely. These respiratory viruses spread in very much the same way. If we do our part as a community, get our vaccines, get our COVID vaccines, get our flu vaccines, be very mindful about our mask wearing and distancing, we can certainly mitigate. We can certainly lessen the effects of the winter of a winter surge. So that's important.
I have an interesting question that was texted in for you. What is stopping people from going somewhere to get a booster shot or a third dose and simply saying it's their first shot? Is this recommended?
Well, Tom, we know that that's been occurring. Most of the pharmacists, most of the pharmacies, most entities that give vaccinations do have an ability to look and verify a person's vaccine status, because there is a state database called Florida Shots that you could look it up, but it's not always being done. So yes, I think it is very easy to, quote, abuse that or get it even before it's truly authorized. It does require trust. It requires the trust of the vaccinator and the person who is telling the story. We want you to be honest about that. And again, I'm very confident that in time, very soon, those of us who need our boosters will be getting that very soon.
I want to stay with boosters. Another question from Facebook: Will you have side effects if you get a booster shot?
So we don't have a whole lot of information about these third doses quite yet, but from what we've seen and from what the CDC has said, the side effects are generally very similar to the side effects that you had with your first or second. It's usually a little bit of fatigue. There can be some that have fever. These are pain at the sites. These are generally very mild and they go away. So as far as we know right now, they seem to be very similar to what we've seen with the first two, the first primary series.
Another question from Facebook: Is there any benefit from antibody tests to see how strong your vaccine response was before you pursue a third dose or a booster?
Antibody tests are one of these areas in which we are still trying to figure out exactly how it can be used in a routine way. Right now, the CDC does not recommend using antibody tests routinely to determine whether true immunity has occurred or not. There are people who may have very low antibody titers that are still protected, and some may have antibody titers that are there that might not necessarily be infected, not necessarily be protected. So at this point, except in some unusual circumstances, we do not recommend antibody testing. There's also different types of antibody testing that looks at certain parts of the protein or spike protein or nucleocapsid. So it's really not very standardized. Hopefully, in the near future, we'll have more guidance on the use of antibody titers.
Dr. Hsu, thank you as always. Very much a pleasure to talk with you. I'm sure we'll be seeing you again very soon.
Thanks, Tom.
And we will be back next Thursday morning with more COVID-19 updates on the AdventHealth Morning Briefing. Until then, stay healthy and feel whole.